Hello friends, did you know that compared to summers, fractures happen more often in winters? Especially if we talk about the season from November to March, fractures increase by up to 40% among elderly people, that is, those above 60 years of age. The fractures that happen most commonly are of the hip, knee, wrist, and spine. The main reason for this is falling or slipping over the floor at night. So today we will talk about the ways by which these fractures can be prevented in elderly people, especially during the winter season. So let's learn how we can prevent these fractures. The first thing is, during winters, most elderly people feel that they should sleep wearing socks. But wearing socks reduces the grip of your feet. So when you get up at night to go to the washroom and you are not careful, as soon as you put your foot on the ground, the chances of slipping increase. So now, what you need to keep in mind is that if you have to get up at night to go to the bathroom, which is a very common problem among elderly people, you can use anti-skid socks. Anti-skid socks will prevent your feet from slipping. Otherwise, if you use normal socks like nylon or synthetic ones, the chances of slipping increase, and this is a very common reason for fractures in elderly people. Similarly, if you are not using anti-skid socks, you should keep a pair of slippers with good grip near your bed. As soon as you get out of bed, put your feet directly into those slippers. Even in this, anti-skid variety slippers are best for elderly people so that they can comfortably get up, go to the bathroom, and not slip. Another very common reason that has been observed is that in winter, we tend to use multiple layers of cloths and blanket. For example, 1 or 2 or 3 blankets at night. So, when they try to get out of the bed, their pajama or foot gets caught in the blanket itself. There are quite a few elderly people who face this issue while getting out of bed. While one foot is placed on the ground, the other foot gets stuck in the blanket and the person slips and falls. This also increases the risk of fractures. So, before you get out of bed, either move all your blankets away and then get down from the bed, or if you use a single layer of blanket or any kind of warm quilt. This is always better than using multiple layers of blankets. Apart from this, there's another reason, feeling dizzy as soon as you get up from bed. It is often seen in winters when the blood pressure drops at night. So, whenever any adult gets up from his bed, the chances of feeling dizzy increase. This is known as orthostatic hypotension. One reason for this is also that people tend to drink less water in winters. Because of drinking less water, when we stand up, our blood pressure drops due to low blood volume. So, one simple thing you can do is to drink a glass of water before going to bed and add a little bit of salt to it. About a quarter teaspoon. If you add salt to 1 glass of water and drink it before sleeping, that's better. 2 things will happen. First, your blood pressure won't fall, and second, many people who get cramps at night, especially tightness or pain in their calves, this will also improve. This is also one of the most common reasons. When someone tries to get out of bed at night, say around 2 or 3 o'clock, and suddenly gets a cramp in their calf, people can fall because of it, and that can also lead to fractures. So the suggestion of adding a little salt to water and drinking it at night will keep your body adequately hydrated. It will also prevent your blood pressure from dropping, and if you have a chance of getting cramps, meaning cramps in the calf muscle at night, it will tackle that as well. Apart from this, when you are going to the bathroom, also make sure that the bathroom floor is not wet at night. When you are going to sleep, do not leave the floor wet. Another thing, if you use those anti-skid floor mats that are available, I often recommend this to all my patients that you should keep anti-skid floor mats in the bathroom so that when you get up and go to the bathroom at night, even if your slippers are not proper or your socks are not proper, at least that mat will give you enough support in the bathroom. Many a times it also happens that when an elderly person goes to the bathroom at night and slips, the direct impact may not cause that much injury, but if, for example, the wash basin hits the head or shoulder, that can also be very damaging. That's why, if you can prevent falls in the bathroom, it becomes a very big helping factor overall. To further reduce the overall risk of fractures, the next thing you should keep in mind is that your room should be warm, because during the winter season, stiffness increases in the joints and muscles, which can lead to poor balance. So if you are sleeping in a room that is cozy and comfortable, then the stiffness and tightness in your muscles will be reduced. As a result, when you will try to get up and walk, your balance will be better and you won't fall because of muscle stiffness. Apart from this, at night I personally advise that you should always use a night lamp. We have seen in many elderly people that when they get up at night and walk in the dark to switch on the light, there is a possibility of bumping into a chair or table and falling down. This can lead to bone fracture. I would advise you to definitely use a night lamp with low power at night. Keep it switched on the whole night, but make sure that the light does not fall directly into your eyes to disturb your sleep. But when you stand up, at least the floor should be visible. One thing that we very commonly recommend is motion sensing lights in the bathroom. This means a light should turn on automatically. This means whenever someone enters the bathroom or there is any movement. We often recommend this in the bathroom because when you open the bathroom door and if it's dark inside, you cannot see the floor. Now you end up searching for the light switch in that situation. During this, if your foot slips somewhere, the chances of falling increase. So if you install motion sensor lights in your bathroom, they are definitely very helpful. Because when you get up at night, you open the bathroom door and the light automatically turns on. Apart from this, there is one more modern technique for fall detection which is now available in our smartwatches and also in our phones, but not everyone takes their phone with them to the bathroom at night. So if you are wearing a smartwatch that has fall detection, you can also feed in emergency numbers and if you slip and fall, the watch detects that you have fallen and it sends a message or makes an emergency phone call to the relative whose number you have saved. This is a very useful feature, especially for elderly people who live alone, because many times the bathroom door is closed. If someone falls and gets a fracture, they can't even open the door or can't inform anyone, especially at night. In such a situation, this watch is definitely useful so that your relatives get to know that you have fallen and they can come and help you. One more thing you should keep in mind is that whenever you are lying on the bed and need to get up and walk, do not try to stand up and walk straight from a lying position. First, sit for a few seconds so that your blood pressure stabilizes. After that, move your legs a little, then stand up from the sitting position and then start walking. Along with this, you should also keep in mind that whenever you select pajamas, wear those that are not too loose at the bottom, because there is a risk of your foot getting caught and you might fall. You should choose pajamas that have elastic at the bottom and are tight at the ankles, so that there is no chance of your foot getting stuck. I hope that these 9 things mentioned in this video will benefit you and help you prevent falls, especially during the winter season. Because if we can prevent or avoid the minor injuries that happen due to falls, that's the best thing. Of course, fractures can be treated, but if we can avoid fractures altogether, that's the best outcome. All the best.